Okay, good afternoon, everybody. Thank you, everybody, for joining today's webinar on the UCL MBA Health. Why now is the time for a specialist MBA in health. I'm Meher from SIUK, and I'm joined by my colleague Aniket. Both of us specifically look into the prospective students who are planning to go to UCL, try to educate them about the requirements of UCL and check that whether they are eligible to apply. So we take them through the entire process. Today, we are honored and happy to have with us Dr. Preethi John from UCL, who's the Deputy Director, MBA Health, and Associate Professor in the UCL Global Business School for Health. So initially, after Preethi would finish the session, we would go through a question and answer round where the students would be putting in the question, and Aniket, my colleague Aniket, would put through the question to the speaker, and she will join where, she will answer those questions. So thank you very much, Preethi, for joining. And so over to Dr. Preethi.
Thank you so much, Meher. And also I acknowledge SIUK at this point and your colleagues, Aniket, Ruchi. I'm just going to take a moment to share my screen. So first of all, good evening, everybody. It's a great pleasure to be here, spend some time to share the details of our MBA Health program. As Meher said, I'm going to be spending some time on kind of walking you through why now is the time for a specialist MBA Health at the Global Business School for Health at University College London, UK. As Meher introduced, I'm Dr. Preethi, and I've been with UCL right from the start of GBSH. And it's been a great pleasure to be part of MBA Health. During the next couple of, I think about 20, 30 minutes or so, I'm going to walk you through UCL, GBSH, get you familiar with these acronyms and understand, what is it that makes them unique. And then talk about the MBA program, MBA Health, which, like I mentioned, is offered in 3 different ways. Talk about careers after completing your MBA. And then kind of deep dive into both the full-time, part-time MBA Health program details, as well as the executive or the EMBA program. Talk about scholarships, talk about upcoming events, and then we will open it up for any questions that you may have. So as a question comes to you, please feel free to write it in and we'll take it at the end. So University College London, my background is actually, the part which kind of welcomes you as you walk into this building. This is where we have our orientation, and it's also the place from where students graduate and have their convocation. UCL is one of the top 10 universities in the world, number 8, It's number 4 in Europe and the UK. It's renowned at number 7, specifically for the medicine program, and globally number 1 for education. It has produced over 30 Nobel laureates, and it's in UK, it is in number 1 rank for research strength. There are over 440 undergraduate programs, 675 postgraduate programs, and spread over 11 faculties. A total diversity of about over 150 countries in our students, among our students. We have close to 50,000 students spread across all these different programs, besides the doctoral program, and about 14,000 plus employees look after and deliver the research and the teaching program. The tagline of UCL from the time of its inception in 1826 has been to really disrupt thinking. And this has been the thought right from the beginning when the founders laid the foundation. The University College Hospitals in London, UCL, which is part of the NHS Foundation Trust, this was opened by Her Majesty the Queen, one of the hospitals which had recently started among the 9. And this is also the set of hospitals that the students of MBA Health will have the privilege to go through, understand how this mammoth set of patient care facilities are managed and led. GBSH was founded in 2021, and it's one of the first schools to be launched in the new campus at UCL East. A wide variety of programs is offered through GBSH, the Global Business School for Health. We have PhD, we have doctoral programs for the MBA students. We have eMBA, which is a completely online program. We have the MBA Health, and we also have MSc programs, all based out of London. One of the most remarkable points about GBSH is it's the world's first business school dedicated to health. You may have heard about hospital administration, healthcare management, these kinds of courses. These are normally offered as MHA, or there are MSc programs. But to have a business school which is dedicated only to providing management courses at the postgraduate and higher level, only in healthcare, I think GBSH has that unique distinction. The idea of GBSH is connected to the Sustainable Development Goal of good health and well-being to ensure healthy lives and promote well-being for all ages. As WHO and other global bodies look at what's happening in healthcare, there was a very strong need expressed that if we are truly to improve healthcare, improve patient care and well-being of all, as much as we need to create or produce competent healthcare professionals, the need of the hour is to address the tremendous shortage that is there in healthcare leadership. And it is this challenge that GBSH has taken up to engage in health and healthcare management research and education. We would like to be able to graduate highly valued, interdisciplinary, ethical, health and business professionals who can truly make a difference in improving healthcare. And this is aimed to be done through the variety of programs I've already mentioned at postgraduate level and higher. But we also have bespoke or executive education courses. We have research as well as consultancy projects. Now, the broad context is, I'd like you to understand that when we say, or when I say MBA Health, we're not talking about jobs only in the hospital or health system. We are talking about how do we address the entire spectrum of industries which are providing healthcare. And I'll go into a lot more detail when I reach the career section. All of us have been through the pandemic, and we have seen how much it has affected our lives and how much our lives have changed due to it. We've also seen how central the healthcare workforce around the world has been. For them, there was no lockdown. They provided their services continuously. There has been tremendous implications on the health system because of this. We have seen the rise of telehealth, whether it be in the developed world or the developing world. We're also confronting economic recession, cost of living crisis. We're looking at addressing inequities, diseases caused by lifestyle. So in this context, you can understand that there is a need and a lot more jobs which have been created in the healthcare industry. And so to address this challenge, which is a global challenge, GBSH came into being. So in short, we are trying to reimagine global healthcare management by the array of courses we offer. We are looking at healthcare challenges, and we're looking how business solutions, management solutions, leadership could actually provide a better solution to what is the current scenario, whether you take waiting times or you're looking at improving patient satisfaction or patient-centered care. So how can we provide healthcare management to inspire public good? This is one of our students in our MBA Health program, Kong. And when we talked to him, Kong, why did you apply to GBSH with your years of experience and you're doing well in your career? The reasons he stated were, one, it was a business school, but dedicated to healthcare. Not only that, GBSH is housed in one of the top 10 universities of the world, which is already strong in medicine, public health, economics. The other was the minute he could get into GBSH and the MBA program, he felt he could access the wider UCL alumni, which is already there. And that was very important for expanding his professional network. Another student, Angel Gonzalez from Spain. He trained as a family physician. He's also completed an MSc in public health. But yet, there was something bothering him. As he provided his care, he wanted to be part of rebuilding the health system. He wanted to innovate and contribute. And for that reason, he felt by joining the MBA Health, he could actually contribute and learn from global best practices? One of the questions that we had posed to him was, why do MBA Health? Why not MBA? And as I talk to students across countries, across different places, this is one of the most common questions. And that is why the theme in today's session is focused on why a specialization in MBA Health and why not just a general MBA. Former Dean of Harvard Business School, Dr. Kim Clark, said that, well, medicine and business have been intertwined for a very, very long time. And yet, these were taught in a completely different way, so that healthcare professionals never had an idea about business. But with this acceleration of how much technology is interspersed in the way we deliver healthcare, and the need to control the cost of healthcare, medication, it has become more and more important for leaders who need to be grounded, not just in the medicine side, but also in the business side, so that the most effective, efficient, patient-centered healthcare can be provided. Health sector is so vast that, you need a grounding, a thorough grounding in it. MBA requires a cross-disciplinary approach, which made it very good for students of MBA Health, because when you are delivering healthcare, if you are a leader of a healthcare institution or a healthcare department, you're talking about a workforce which is interdisciplinary. And it is extremely important to appreciate the multidisciplinary way of teamwork. So there are tremendous changes that are happening in healthcare and in terms of leadership opportunities. And we looked at the landscape which is out there and felt that we need to capitalize to really train students who have that need or that urge to make a difference in healthcare. So why gain an MBA or an EMBA? Very often, once you have worked for, let's say, a couple of years, 5 years, 10 years, 15 years, you kind of start thinking, what am I going to contribute to the world? What's your legacy going to be? Or that, you have specialized in something and you'd like now to see what other opportunities are there. So one, we definitely feel with the MBA Health or an EMBA, it opens up a new world of career opportunities. There's a whole focus, one, at developing the leadership or the managerial aspect of the individual. There is another focus, which is to develop the professional. And so on one part, the focus on developing the individual, that is each of you who join this particular program, to shifting to kind of how can we contribute to the organization or the health system as a whole. So during the 1 year of the full-time MBA, or the 2 years of the part-time MBA, or the 2 years of the EMBA, you kind of build your portfolio so that you have a really transformed CV at the end of the course. Most of the students, they are looking for an experience and they want faculty, guest faculty, who will take them to the world outside and make them understand what are the dilemmas they have faced. How did decision making happen? How can you become better at decision making and therefore leading? How do you lead change? How can you lead technology transformation, which is happening in healthcare? What are business models in healthcare? And yet, even though the word business is used, it doesn't mean that we are talking only about a for-profit healthcare. So who is the right individual which can take up this demanding MBA program? We are definitely looking for students with fire in the belly, ambitious students who are kind of like raring to take up leadership opportunities very early on. Currently, you may come from a medical, healthcare, clinical background, or you may come from a non-healthcare background like engineering, accountancy, or you've been working as a consultant, and you're just looking for an opportunity to elevate your career. Well, irrespective of the background, if you're trying to leap forward, accelerate your career, then again, this MBA Health program could be the right match for you. You already have experience in healthcare management or leadership, but was not trained particularly for it, even though you have taken up the role, and you are interested in just really taking that forward. So anyone who's listening today and who is thinking, I really want to make a difference in the world of healthcare. I'd like to improve patient care. I'd like to improve well-being for all. And if you really want to change the world, then that's the kind of students we are looking for. Here is another student, Alexandra Hughes from Scotland. Initially, as a medical doctor, she thought she will do an MBA. But she felt that in an MBA program, healthcare is kind of an afterthought with very few examples from the healthcare world, very few case studies, very few perhaps faculty who come with that perspective. She was looking for a program which had healthcare at its heart and which gave a perspective of what's the future of healthcare going to be like. So what is the value, whether it's an MBA Health or an EMBA? One, the training in healthcare management is common. There's a whole focus on the health part as well as the healthcare part. A lot of training on both the technical and soft skills. And the MBA is already a very established degree, and it conjures up image of the kind of degree that leadership would have done, whether it is the CEO or CTO already in organizations. What is the right time to apply? You could be young, early in your career, but with ambition to make a difference, or you could be mid-career and you really are looking for some change, a big change. Then, in both cases, it could be the right time for you. So there isn't a right time for the class. It's the right time for you in your life, whether an additional degree such as this unique one would help you get ahead to make the change you want. I've already talked about the position that UCL already has as one of the top 10 schools in the world, top 10 universities in the world. And so just being in that environment, the kind of students, the kind of faculty, the kind of network that you have It's something that is very exceptional. At UCL, GBSH, whether it's the EMBA or the MBA Health, we feel our students will really stand out in the industry because, one, they have the deep dive in the healthcare sector. Health is not a byproduct. It is the core of what we teach. And we are focusing on creating healthcare leaders. And it's not going to be a program where you are cut off from the healthcare business world or the healthcare world. It's a program where the industry and the academia has got a strong meeting and tremendous opportunities to engage with the healthcare industry as it is. We have a very unique executive in residence program, which comprises of former CEOs, current CEOs, who act as mentors for our students. We have a career coach who work with the students so that their placement can improve and get them ready to meet that. And of course, once you are a UCL alumni, you can leverage all the opportunities that UCL provides to their alumni. Another student, Mateen Elahi from Pakistan, he's a GP in the NHS, and during COVID, as he provided his services, he really felt if he really wanted to serve NHS, he needed to learn management. And that is what made him come into this program of MBA Health. This is a photo of our residential week at the start, where we kind of take students out to bond with each other because the students come from tremendous diversity, not only of countries, but kind of backgrounds that they come at the graduate level. Now, careers. As you know, a healthcare career is not just about hospitals and hospital systems. All big 4 consulting firms, whether it's PricewaterhouseCoopers, Deloitte, KPMG, or McKinsey, Boston Consulting, they're all looking at health consultancy as a key area. So that's one potential area to get a career in. You could get jobs within, whether it's the pharmaceutical sector, the life science sector, biotech sector, whether it's in the government side, the private side, the charity or the NGO side, or even in international organization, international development organization, including at WHO or global equivalent. That's a possibility. The pharmaceutical sector. Another new area that has really emerged is the digital health space. There are tremendous health tech, med tech companies. You could go into health policy, you could come back into an academic role, you could become a medical director or a C-suite role even inside hospitals, hospital chains, accreditation bodies. So the UCL MBA Health as a full-time model is 12 months, part-time spread over 24 months. The next program is scheduled to start in September of 2023. The location is in the UCL East Campus in London. It's a 20-minute ride from central London. And the idea is, like I said, we are trying to bring not just world-class academia, but marry it with really good industry experience and see how over time, through our alumni, through our placement, how our students will change the health sector for the better. So if you are a full-time student and you enter this, What it means is literally on 25th of September, our course will be starting for MBA Health. So 2023 September, you join. August of 2024, it will finish for a full-time student. There are 6 teaching blocks during this 1-year period. The classes are from 1 p.m. to 6 p.m. daily. This allows for students who are working to use the morning time for working. So typically, Monday, Tuesday, Thursday, Friday is the days when we are teaching a particular teaching block. Now, the teaching block could be it could be strategy, it could be accounting and reporting, health economics, or contemporary topics in health and healthcare. These 4 are the main 4 teaching blocks, which are offered, like I said, Monday, Tuesday, Thursday, Friday from 1 to 6 p.m. Wednesdays, we use for preparing for the consultancy project, research skills enhancement, career, maybe coaching or giving talks about possible careers, personal professional development. The 2-week health challenge fieldwork, there is a module which is called Global Health Challenge Project, which is done by taking students to different countries. So a group of students might visit a country in Africa or in the Middle East or in Asia. And then they take up a challenge and work on it as a team. So it's a team project. But there is also a consultancy or a research project where you actually will do an individual consultancy assignment. So if you are part-time, then how it works is in the first year, you would be doing 3 of the 6 teaching blocks. And the second year, you will be doing the remaining. So you'll do the odd 3 in the beginning, and the even 3, you will do it in the second year. So the part-time students will actually be studying with 2 cohorts. Since the students are worried that, okay, I am coming from a medical background, or I'm coming from completely non-healthcare background, how will I manage? We have some online primer courses. These are to help you get settled into the course. Once you arrive, we have a residency off campus, besides an induction program to the university and an orientation program to your program and your cohort. There's a lot of baseline testing which is done to kind of figure out what is the individual input that you need to build your career or to build your leadership. As I mentioned, out of the 6 modules, 4 are considered as teaching blocks with 30 credits. And the other 2 blocks are what you might have called it as internship, where the work is done not necessarily in a classroom, but actually in the real world. So the Global Health Challenge, just to talk about it a little more, this year, the students, one group is going to Saudi Arabia, another group is going to India, another group is going to Egypt. In each country, they visit 2 cities, understand the health system. There will be a theme. So the theme has been, for this group, it's non-communicable diseases. Each group thinks about it in a particular way and takes it forward. They come back and as a group will work on delivering the assignment. The second, which is an individual one, the student is expected to work as an individual, and you'll have a career coach, other mentors who will support you. And the idea is maybe 1 or 2 students might go to one particular organization, work on a live project, deliver the consultancy, and come back. So the time period of this is the 4 teaching blocks end by March, and then from April to August would be the consultancy, with the final submissions in September. For the EMBA, it's spread over 2 years. It's completely online with 2 annual health system residential weeks, in the first year in London and second year in US. So it's the same set of teaching blocks, with in March being the UK Health System Study Week in 2024. And then in the second year, term 3 is when the trip to US would happen. But this is offered online, and you could be in India, you could be in any country, any place. You might be traveling, maybe for work or something. It doesn't matter which city you are in as you do this. So again, for the EMBA, students have an opportunity to have some primer courses so that they can get ready, become more skilled, become more comfortable, and not be worried, oh, will I be able to manage? So as I mentioned, this is again delivered in the 4 30-credit blocks. And it's pretty similar to the other one, except some of the teaching methodologies would be different because one is face-to-face and one is online. So this is the research project where, as part of the EMBA, you will take up a particular research topic of your interest. You'll work with your supervisor to deliver it. So coming down to what is the actual requirement, who in terms of an eligibility, you require an upper second class degree of an overseas qualification of an equivalent standard. If you have work experience, it is very important that you mention it because that does have value. IELTS is compulsory, and you need to have the requisite scores in order to be eligible for this. This is a UCL criteria. For MBA Health, we would prefer candidates who at least have minimum 2 to 3 years experience. However, when we see the batch, the average age is in the 30s. For EMBA, we would prefer at least 5 years worth experience. For the MBA Health, full-time or part-time, a GMAT score, or if you have a GRE score, that would be preferred. For EMBA, that is not required. If you apply for the EMBA or MBA Health part-time, full-time, you will mention it in your application, and you will be called for an interview. You will also, with your application, you would have provided your personal statement as well as 2 references. And this is basically to check, why do you want to do this course? What is the change that you want to make? So I've already mentioned about the GMAT, and you can, these links will be shared with you, and you can check it out and see for details. Now, if you're thinking about the interview, I'm actually telling you what is the common set of questions that we normally ask in the interview. Almost every interview that you would have asked would always begin with, tell me about yourself. How do you put your best foot forward? Where do you want to apply for this program, whether it's a part-time or full-time MBA Health or the EMBA? And how do you think you stand out among other candidates? How can you contribute to our MBA Health? Because it requires students who will be highly participatory in class. There's a group discussions, a lot of case study, discussions, debates. That's kind of the learning methodology which is used. And what do you expect in terms of your life, in terms of your career? What do you expect from this program? What are your strengths? What are your areas of improvement? Now, this is because we want to understand if the student comes in and we have to work with the student to improve their individual skill set. How do we do that? We need to be aware. And where do you expect to be in 5 years? Do you really have that burning ambition to take up a leadership position? We have a LinkedIn page, which is, usually we start it for MBA Health offer holders. So once you apply and you've gone through the interview, then we normally put you to this, because then a lot more questions. At every stage, we find students have questions, so we take it up at each phase. This is a Roche scholarship student, Tamina. She came in with experience and she's got this scholarship, which enables her to study MBA Health. There are several scholarships which are available. Each one is of varying amounts. The ones mentioned here are particularly, which is through GBSH, but you could be eligible for Chevening Scholarship or any other scholarships that is generally available to any student who wants to study in UK. So UCL does participate in the range of graduate taught funding programs, whether it's both in UK, US. So besides Chevening, which I mentioned, Commonwealth Scholarship, Fulbright Scholarship, grade, master's bursaries, there's a whole set of scholarships that you can avail by applying for it separately. Han Liu from Singapore is another student with us, with a background in nursing, very ambitious. And he feels now is the right time to get your MBA Health, because the post-COVID, suddenly the healthcare sector has kind of realized the value of not just the healthcare professionals, but really high caliber, high quality MBA or healthcare management professionals as well. There's a lot of support that is provided through the department or through the school. So a variety of coaches, career coaches, mentors, personal tutors, executives and residents. These are some examples of some of the people who are on board as the health executives and residents, which our students are able to access and get guidance from. David Probert, he's the CEO of the UCL Hospital. He's part of our teaching faculty, and he really provides his time in order to ensure that the students understand how the UCL Hospital kind of is led. He shares several case studies, both of success and failures. Besides academics, there are several other extracurricular activities that you can participate in, whether it's sports, other clubs, students' union activities, volunteering. And at UCL, it's also about life in London. Bloomsbury is the home of Central Central London and the main campus. Well, We are situated at UCL East 20 minutes away, and it's right next to where Olympics was held in 2012. So the aquatic pool, the Olympic stadium, so it's massive facilities which are available to the students at UCL East. Parks, greenery, festivals, museums, I mean, all this is around, it's just probably a walking distance away. These are about the doctorate in business administration, and it could be in any of these topics. We are looking at people who really have some work experience besides research to do this. And for further information, you can always go to, there's a lot of information on the website. There's a lot of information via the YouTube as well as the LinkedIn page. And with that, I'm kind of at the end of the session. And so I would kind of stop sharing my screen. My email ID is provided. If you would like to have a one-on-one meeting, please do write. preethi.john@ucl.ac.uk is my email ID. So I'm going to just stop sharing.
Thank you so much for this extensive PPT, Preethi. Hello?
Yes, I can hear you. Thank you, Aniket.
So we do have few questions. You have covered most of the aspects, but let's take it one-on-one with the students too. Okay. So definitely we have students asking questions coming from various fields. Okay, like few of students coming from industrial engineering, human resource management, and few students coming from commerce background. Would like they need your advice. Would they be considered for this particular program, for global health MBA program, MBA health program?
Okay. Thank you for the students who asked that question, because I think it gives me a chance to respond to that important question. This is something that, again, like I said in the beginning, a common question to us is, how is MBA different from MBA Health? But this is another important one about what is the value of students who are not from a healthcare background or medicine or nursing or something. I cannot emphasize how valuable, if you are from accounts or finance or HR or engineering, industrial engineering, it doesn't matter, sports, whatever background you are from, healthcare needs you. Healthcare needs you because when we are talking about healthcare management or people in healthcare leadership positions, we need people who will value other disciplines, because it cannot be only one discipline which can take health sector forward. No. So into the MBA Health, we welcome any student with any background, provided you meet the other requirements of IELTS or, all of that. But, very often what happens is when the commerce student comes, they're very worried, oh, will I be, am I the right fit? And then you have all these medics who are very worried about courses like economics, accounting, and suddenly this person who's from that background is the one who's shining and explaining to everybody. And you have the engineering person who understands about technology and several other points. So in short, it really doesn't matter what your background is, as long as you have that desire that you would like to contribute to healthcare leadership and become a great leader yourself. I think that's what's more important, the attitude.
Sure, thank you. So the next question we have is, I'm a dentist and currently doing clinical practice as a junior dentist. Will that be considered as work experience?
Yes, of course.
Okay.
We in fact have several dentists who join our program. So any clinical, so we're not saying that your work experience must be in healthcare. It just matters that you have worked irrespective of the industry. But clinical experience also counts.
Sure. So on the similar lines, we have one more question that I have done my MBBS from MUHS, which is Maharashtra University of Health Sciences, and have around 3 years of experience in a private practice. And somehow I feel I'm a borderline eligibility. So I just meet the minimum eligibility or might fall short. Can I still apply for the course?
Well, I'm not sure why you consider yourself as borderline, because I mean, you've got a great educational qualification, you have work experience, and that's it, you know. So the other things, if you're there, you're certainly not a borderline as long as you're highly interested and you have the required minimum marks and all of that. You're a perfect candidate for this course.
Sure, great. We move to the next question. For the module data-driven management, does any specific background in coding or language is required?
Not required, because in this particular one, the whole focus is the current world we live in is data-driven, it's digital health. So the idea is, again, at the leadership or management level to kind of build you up, so that if there is some work which is required to be done by coding, you know how to do those conversations and check that the work is moving forward. But you do not need to come with any of those skill sets. That is not at all a prerequisite.
Surely. The next question is, I guess it was just before you explained about the primary research work with the field trip which you take. So the question is, will the 2-week trip to be which we take as a part of the program will be to NHS hospitals or any other regional areas?
So the 2-week trip, if you are part of the full-time MBA Health or the part-time MBA Health, it is to a developing country. So like I said, this year, the visit was to Egypt, Saudi Arabia, India. The students will visit NHS as part of the program, as part of like field visits, things like that. You will be visiting it anyway, whether you're part of full-time or part-time, the MBA Health course, because like I mentioned, David Probert is one of our teaching faculty and he always takes students to the hospitals. If you are part of the EMBA, the way we try to provide that exposure to the NHS is during your 1-week residential course. So at that time, the idea is to give you an insight or a deep dive into how that works.
Thank you. Move to our next question. Okay. So what are the job opportunities available after completing the global MBA program?
So after completing the MBA Health, the idea is that any management or leadership position, whether it's hospital or it's health system, government or private, that opens up. Other sectors like health insurance, pharmaceuticals, life sciences, biotech, telehealth, startups in healthcare, digital health companies, all of this opens up besides healthcare consultancy. So I think there is quite a wide span of careers that open up once you complete your MBA Health.
Sure. Right. Thank you. The next question is, what is the classroom size we can expect for this particular program?
Yeah, the classroom strength is kind of between 30 to 50. I think that's the range, in the sense that we started with about 30, but we are increasing our strength towards 50.
Okay. And similar in the lines of the same question, the same student has asked it. So how many scholarships do we provide in each particular intake? Is it a fixed number of scholarships are provided each intake?
I think right now, so the Roche scholarship, which is the completely fully funded, that is a single one particular scholarship. The ones which are 15,000, 10,000 or 5,000, there are several, maybe it's 5, 10. We have a team who's constantly working to see how we can increase scholarships to our students. The chevening, all of that, Fulbright and all, that's on a public, I mean, where you are competing it for it among other courses, not just for this course. But the ones which are mentioned on the slide earlier, that's particularly only for GBSH MBA Health applicants.
Right. As the MBA Health program requires GMAT or GRE, what is an average score expected by a candidate?
I'm going to kind of defer this question
Okay.
and probably would get back. Yeah.
Sure. Just going through, I guess we have 1 or 2 questions. Coming from humanities background, will any community service or any kind of social work help me out in getting an admit at this for this particular program?
We
Not-
value, I would say, as like when you say social work, that's what you were mentioning, right?
Right. So to rephrase his question, it is more about he wants to show that he has empathy towards the society and wants to work in health sector. This is what I understand. Okay. So he wants to correlate that work with the program, and that's why he wants to know that will that be a value addition for him?
So we are looking for one part in the interview, we are looking for attitude. So anybody who's empathetic, has done a lot of community experience in volunteering, it's considered a good asset. It's considered great if you have that skill set, because in the head without empathy. So it is a great skill if you already have it.
More or less, we have covered all the questions. That's all. Thank you so much, Preethi, from SIUK team, and we have had a wonderful presentation. I'd like to hear last words from you.
I just quickly got an answer to that question about the GMAT score.
That's great.
So I'd like to kind of take the opportunity to just share that. So for this, essentially a score of 550 and upwards. In conclusion, what I would like to say is at this point, it seems very favorable, UK as a destination, generally overall, with the 2-year stay back as well, and with kind of a lot of vacancies opening up in the healthcare sector. Second is UCL is just an amazing place. I mean, in terms of, I mean, you want a global network in 1 year. You know, you just come to London. It's such inclusive, diverse. You're never going to feel out of place. So I think that's amazing. And I think the kind of the people that are there, I just think you will really feel it's a great investment of your time, of your resources that you have put in if you opt to take this up. And I'm sure there's going to be a positive pivot to your career as well. All the very best. And we, of course, are available to answer questions, maybe through other means like email or LinkedIn or through SIUK. And once again, a very big thank you to SIUK for organizing this. Thank you.
Thank you. Thank you so much, Preethi.